Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about the 5 biggest things that I recommend and implement in my practice for maximizing regenerative medicine results. If you stick around, I'm going to give 2 bonus ones at the end of the video as well. The reason why this is important is because these regenerative medicine treatments, they're not covered by insurance and can be quite costly for some individuals. So if you're going to put that investment in yourself and in your body to function better, to decrease pain, to meet goals of fitness or getting back to play or just living life again, then it's worth your time to make sure that you're going to get the maximum benefits out of that treatment. And the whole concept, it runs around the idea that if we stop looking at our bodies as individual parts and as a whole system and how the system works within itself, then we can start making better decisions on how we treat our patients and how we can treat our own bodies. It's very important for me to walk my patients through this. And if you are interested in getting regenerative medicine treatments and your practitioner isn't talking about these things, then maybe you're not in the right situation, not in the right area. Because we've seen better results because of the implementation of these tips and tricks. So let's dive right in. First and foremost, the lowest hanging fruit is if you use tobacco products, nicotine, smoke cigarettes, smoke cigars, you need to stop for at least 2 weeks. Hopefully longer, but 2 weeks prior to, I recommend my patients 4 weeks, and then at least 2 weeks after. And the reason is because we know that smoking cigarettes can cause whole lot of problems in the system. It can cause inflammation. It can cause decreased blood flow, decreased oxygenation to tissues. It can also leave us with reactive oxygenated species, which can cause more damage to cells down the road. If we look at the system, as I'm talking about, as a cardiovascular, respiratory, endocrine, and immunomodulatory system that's kind of hitting most of our organ systems in our body, and we start looking at it together, this is one of the big reasons why we want our patients to get off of cigarettes in general, but specifically around the time of the regenerative medicine treatments. Because if we can't get the oxygen in the blood cells and the growth factors to the area of interest, then we're going to yield worse results. And this is also very important for patients that are going through surgeries or just wanting to improve their lives in general. This is such a low-hanging fruit. And some patients will say, okay, well, what if I do my nicotine pouches or chew nicotine gum? Though it's likely better than smoking, the problem is, even with the nicotine, there are receptors on our blood vessels that will cause vasoconstriction, so they tighten up. So that leads back to the point we're not going to get the blood flow to the areas of most interest. And if we don't get the blood flow there, we don't get the growth factors, again, we're going to yield worse results. In the same concept, we recommend patients avoiding alcohol. Now, there's a big debate out there, right? Is some alcohol okay? Should I drink certain types of alcohol? Right, the studies on red wine and how it could be linked to longevity and increased blood flow. For all intents and purposes, I would probably say no alcohol is best, but if you are going to enjoy your glass of wine or have a beer or maybe a cocktail, then limit it to very, very low amounts. And I would definitely not recommend it around the time of your procedure, at least 72 hours before and at least 72 hours after. But again, in my practice, we recommend taking at least a month off before and then at least 2 weeks after. Longer, better. Alcohol has other issues besides the negative effects that it might have on our body, but it decreases our sleep infrastructure. It can also cause inflammation in the body, especially when it's mixed with sugary or other toxic additives and dyes and that kind of stuff. And this is a big reason why recommendation of alcohol is to cut it out if possible. In the same concept, and this probably goes without saying, but it probably needs to be said, if you do use other drugs recreationally, then maybe it's time to take a break from those as well. Of course, IV administration of drugs is probably a complete no-go, and more common nowadays is the use of marijuana, though. And marijuana can quite frequently be smoked or vaped. And again, that kind of goes back to the idea. We don't know. There's not as much evidence on that out there right now. But if we're going to try to maximize our results, this would be a good idea to something else to stop. With that being said, if you're someone that does use these, can you use tinctures or edibles? Again, I don't know. There's not enough studies out there to tell us, but it's something to consider to just stop if you can. The second topic on the list would be utilizing a great diet. And what I mean by a great diet is a Mediterranean-esque diet, which is more on the anti-inflammatory side. This looks like something like a lot of vegetables, green leafy vegetables, but also other vegetables, both raw and cooked, a high fiber content, lots of olive oil that's not processed or very minimally processed, and not using these oils and fats to be burned, but to be additives to your foods. It also includes, lots of lean meats and fishy meats. Poultry is good because of the leanness. The idea is to stay away from highly fatty red meats and inflammatory red meats, especially when we add these to things like alcohol and sugar and highly processed foods. These can potentially cause more inflammation in the body down the road. As a practitioner, when we do platelet-rich plasma, for example, and we draw out the blood, we can see the thickness of the blood. And I promise you, we can also see patients who have high cholesterol in their blood because it does chunk up and you can see it. And there are studies that are emerging that are showing that keeping those fatty foods, highly saturated fatty foods, out of the system can help with the outcomes of our regenerative medicine processes. Some practitioners will go as far as going into a vegan or vegetarian diet. I haven't necessarily seen that, and it's also very restrictive for most individuals if they don't already practice that kind of diet. In that same concept of diet, I want you to avoid, and I tell my patients to avoid, sugary foods, highly processed foods, fast food, refined carbs. All these things can really diminish our metabolic efficiency in our body. And that doesn't only interrupt our endocrine system, but also our immunological system. And we want those both to be as healthy as possible for when we are going through these procedures because they both directly impact how the cells react. Think about it this way. If you have someone who's constantly inflamed because of the foods that they eat, their diet, and their lifestyle choices, then they're more likely to get sick at a baseline. So if we have a healthier individual that adheres to their strict diet, then they were less likely to have that inflammation in the body and less likely to get sick. The next topic would be a workout plan. And this includes, from the studies suggesting that you do a high intensity interval training type or VO2 max type training for 4 to 6 weeks prior to your procedure. And then after the procedure, it's going to be difficult to maintain that because you're going to be healing, but you want to pick that up after you're able to once again. That is one part, and I've talked a lot about high intensity interval training and VO2 max training in other videos in the past, so go dig those up, and hopefully that'll help give you guidance. But you can definitely do a Google search or now AI search on what this means and how you can implement this. And if you're working with a trainer, you can let them know that, hey, these are some of the goals that I have, and this is what I want to do. So implementing something like that 2 or 3 times a week is going to be very beneficial for you. Your cardiovascular fitness in general is also going to be important. So that looks like more long form cardiovascular training, maybe running a few miles or walking a few miles, hiking for a few hours. And these aren't short bursts of 10 minutes, but 20 plus minutes is really what's important. The other area is our muscular strength. We know that the mesenchymal stem cells and stem cells within our muscles can activate the stronger we get. This is why people, when they lift heavy weights, they grow muscle because they're activating stem cells. There's also enough evidence out there to show that stronger bodies and healthier bodies can improve our immunological function. Essentially, our immune cells are better functioning to treat inflammation and pain. So again, if you're working with a trainer, that's something that we highly recommend because that's very important for your long-term outcomes on these regenerative medicine treatments. The next thing I want to talk about would be in this similar concept, but slightly different, is you want to make sure that you're doing the appropriate pre-hab exercises for that area you're treating, and also have a detailed plan post-procedure to make sure that you're getting the maximum benefits. Quite frequently, people will say, well, isn't this just like a steroid injection where you inject me and I'm all better? Well, even with steroid injections, we recommend you building up the structure and the strength and the flexibility and mobility around that joint or the area of interest before that injection, because then that'll help your post-injection recovery, and maybe you won't need extra steroid injections in the long run. It's no different with these regenerative medicine treatments. In fact, it's my opinion that this is one of the most critical portions of regenerative medicine or any treatment that people are missing, is doing the rehab before and after. Now, that can look different for different people, but it's really focusing on those core functions of strength, mobility, and just stability of the joint or the area of interest. Now, you won't get 100% because that's why we're treating something, but the whole idea is if we do it beforehand, we get enough strength, then when you're on the recovery side, you're going to have a better outcome because you're going to know these exercises. You're going to have the neural wiring pathways that are going to help make it more effective. The number 5 tip that we tell all of our patients 100% is having a supplement regimen. Again, I made a lot of posts about this. You can find it on my blog, on my website, essentialsportsspine.com, or my Substack, Nikhil Verma, MD, Substack, Essentials of Healing. And those are some great tools to use to help maximize the effectiveness of your regenerative medicine treatments. Some recommendations would be collagen, high-dose vitamin C, vitamin D, magnesium, specifically magnesium glycinate. Sometimes we'll add in fish oil or curcumin. We try to avoid those around the time of the procedure just because they can increase the blood thinness and how easily you bleed. And They may have an effect on platelets. It's a little bit out there. We don't have great studies, but these are some general recommendations to help. Now, what's becoming more popular in the world are the world of peptides. I'm going to kind of underclass these there. There's a little bit of legality issues with it right now. Yes, there are some that are available, but can be very, very exciting in the future if we do get studies to show that things like BPC 157, which you can get orally legal from supplement sites, but TB 500, GHK copper, these are some ones that can actually really benefit our system. And then the other one I'm excited about is thymosin alpha 1, which is another one that can help with immunological function. I'll leave that as a Substack. I'm going to make a whole other video about peptides, or probably a multi-step series of peptides breakdown. So stay tuned for that in the future. So those are the 5 big ones: avoiding drugs, alcohol, tobacco, nicotine, diet, exercise regimen, pre-hab and post-hab, and supplements. Now, here are the other 2 that I find very, very useful. I'm very excited to see what happens. One is something that we have here in our office, is the MLS laser. Now, the MLS laser system can help increase the blood flow in the area, increase the cellular energy through ATP, decrease localized swelling. It can also potentially help activate some of those stem cells that we want that are kind of dormant in the area. We don't have great data on this yet. There's a group of physicians out there, myself included, that are trying to get the best practices and best protocols. My current protocol, my practice, is we do a handful of sessions prior to the procedure. We will do one the day of the procedure after the procedure's done. And then after about 3 to 5 days, we'll get patients in for a handful more. Now, some people say we need a bunch before and then less after. Some say we need a bunch before and a bunch after. Again, we don't know. We're trying to figure this out. I believe in this so much because of my own injury when I was treating my knee, which had a nerve that was compressed, causing some knee pain. I used this laser for about 4 sessions, and I was 90% better without any other treatment. Now, I know I don't have any structural damage that I would need a regenerative medicine procedure, but that was amazing results firsthand. But also, I had a patient who was 71 years old. She was ready for a hip replacement. And we did 4 sessions of laser before her stem cell procedure. And she was already telling me, I'm able to walk further. I'm able to do yoga. I don't need my cane when I go in public anymore. I've been able to exercise for longer. It's been incredible. So that was kind of one of the big things to say, hey, we really need to start focusing on where this goes. The last one, number 7 here, would be something that we don't have in our office, but we usually partner with somebody in the area, and that's a hyperbaric oxygen chamber therapy. Now, this isn't one of those soft shells. This is actually one of the medical grade devices where you go into the device and you can't take your phone in there, no electronics, because it is a risk for combustion, and you definitely don't want that. So it's very important. In the same concept, it helps increase our metabolic function and able to deliver oxygen and other substances to the tissue. And when we have a better metabolic rate and a better metabolic healthy system, our chances of improving our regenerative medicine outcomes increase significantly. Again, not a lot of studies out there right now, but this is something I'm really excited about, and I'm trying to partner with more of the chambers that the areas in Columbus that have some of these chambers to help our patients yield best results. So there it is. There are the 5 main tips that I give 100% of my patients, and then the 2 bonus ones. If you're not in the Columbus area, I would recommend at least doing those first 5. Those are things that you can do by yourself. And if you want some more information, feel free to go through my Substack and go through my other videos on my YouTube channel, and that can help guide you a little bit. But if your practitioner is not talking about these things, then you really should be looking at, am I with the right practitioner? And in my case, I've absolutely helped patients that have gone other places and got their PRP treatment, but they've come to me just for the laser. And that's another option for some individuals. Anyway, I hope you guys found this useful. Please share, please like, please subscribe. And if you have any questions, feel free to drop them below or send me a message. And my question to you is, what else do you recommend? If you're a practitioner in this space or you have more ideas to increase our results for our patients, I'd love to hear. And we'll talk to you soon. Take care. Bye.